Hello there, I'm Miranda and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
My name's Sarah Jervis. I'm a staff nurse in Pre-Op Assessment Clinic at the North Norwich Hospital, and I'm also a full-time carer for my mum, who is 94 years old.
We're talking today about Sarah's experience of being a carer. Now, interestingly, many carers don't see themselves as carers, as it can be difficult to see the caring role as separate from the relationship they have with that person. So let's start with the definition of being a carer. So it's anyone who looks after a family member, partner, or friend who needs help because of their illness, frailty, disability, mental health problem, or an addiction and cannot cope without their support. So, Sarah, tell me about your experience of being a carer with your mum.
I've been a carer for my mum for quite a few years, actually. I would say on and off for a good 10 years, because she got registered blind about 10 years ago, partially sighted. She's got macular degeneration. I was also carer for my stepdad as well, because he was registered blind as well. And he had Alzheimer's, so I didn't live with them then, but I live with my mum now. But I was there, more or less their carer, taking them shopping and guiding them, because neither of them could see very well. But now I am a full-time carer for my mum. I've been living with her since 2019. That actually was quite good, because that was just the year before COVID struck, and I really don't think she would have coped at all. She's 94 now, 95 in July. She's frail. She's got quite a few health problems, and she's now on palliative care pathway. So I need to be here all the time with her, basically.
It's a lot, isn't it? It's a big shift, I guess, in your family life
Yes.
to move in with your mum and take care of her.
Yes.
How
Yes.
what impact did that have on you and your family?
Well, I haven't got a partner. I'm divorced, but I am lucky that I've got two sons and four grandchildren who all live in Norfolk. So they support me when they can. They're very good in supporting me. My brother, unfortunately, is up in Yorkshire, so he really can't get down very often. But we talk on the phone, and he supports me that way. But yeah, it is hard, because I can't get out unless someone comes and sits with my mum, basically, and relieves me. So I do get quite isolated, but I wouldn't have it any other way. But she's my mum.
Do you have any support then from sort of in those moments when you might want to say go and do something for yourself and have some time? Do you have a support network who can come and sit with her? Do you use sort of caring organisations as well as sort of family and friends?
I have actually found carers breaks, and actually yesterday I got out for 5 hours because someone called Ryan came from that organisation. I got hold of them through Carers Matters. I've done a lot through Carers Matters, actually. And he came and did an assessment with me to talk to me about my mum and her needs. And I was actually able to get out for 5 hours yesterday. And oh my goodness, that was, it's not that I want a break from my mum, it's just I need to get out and get fresh air, get exercise, do lots of little errands and things like that. Yeah, and have a coffee. And it when I come back quite refreshed.
Absolutely. And I think that's so important, isn't it? Like they say that we are a life raft if you're a carer or even, a parent or anybody who looks after somebody, you are a life raft. And if there's no air in that raft, you can't
Yes,
support the person. So it's so important that you get that help.
yes, yes. Even if you go out for a coffee and you do people watching, that's just lovely. It's better than the four walls, because we had bad weather and I haven't been able to get outside. And yes, I have felt like I felt a bit trapped, actually, sometimes. Unless you're in this house 24 hours, I don't think you understand. I mean, my sons and my daughter-in-laws, they understand, but yeah, unless you are in that position and you're living through it, I don't think you can understand it, really. But as I said, I wouldn't change it. I want to look after my mum.
No, I agree. I think it can be quite physically demanding as well as mentally, can't it? Especially if you
Yes,
are the sole carer,
yes,
you've got to deal with bedtime, you've got to deal with getting up in the
yes,
morning, and how do
yes.
you find that side of things?
At the moment, my mum is in a hospital bed upstairs, finding it really tiring going up and downstairs. She's got a stair lift, and I'm quite tempted to use it. But yes, I don't know how many times I climb those stairs and come down. And it's not because she's demanding, it's because, I do the meals, I take those up. I do the drinks, take those up. But I don't want to stay downstairs all the time. I want to keep her company and talk to her. So, yeah, physically and mentally demanding it is.
That's talking about in the house, but obviously, you mentioned you need to take her out to appointments, to go to the doctors and all sorts. So we're going to come on to the carer's identity passport in a moment, but before you had the passport, tell me a bit about what it was like to take your mum to an appointment.
We had really quite a bad experience when she went in hospital in 2020. And I appreciate it was in COVID times, but I wasn't allowed in the ambulance. I wasn't allowed to go in hospital with her. And communication with the ward was dreadful. And it was just a nightmare, to be quite honest, because being partially sighted, and she's also got 2 hearing aids, so she's hard of hearing as well. She was really isolated. I felt isolated at home. She felt isolated at hospital. She was put in a single room, and really, I know I'm a nurse, but the nurses, I don't think they understood what it's like to be partially sighted and you can't see what's put in front of you, like food, even opening some sandwiches or something like that. My mum needs help with that sort of thing. Yeah, she came out of there quite traumatized, to be quite honest. But she's been in hospital February of this year, and I had the carer's identity passport, and it was fantastic. Really good experience. Really good.
Interesting. So let's talk a bit more about that. So, for anyone who doesn't know about the Carers Identity Passport, this is something that was launched in November 2022 by Carers Voice Norfolk and Waveney. And it's a real collaboration from feedback that was received from carers across Norfolk. Local NHS trusts, including ours, NCH&C, collaborated with carers and local carer organisations to co produce this Carers Identity Passport. And the idea behind it is to ensure that carers are recognised and can get the help and support they require. So it sounds, Sarah, like you really did get that help. What kind of a difference did it make?
So I wore it as a lanyard around my neck. As soon as I knew she was going in hospital, I put it on. And it enabled them to identify me as a carer and not just a relative. I was a relative and a carer, and I knew my mum inside out. And I think that's what it's all about. As a carer, you know that person more than anyone does. And I was able to, explain to them her needs. And yeah, they were so good. They looked after me as well, basically. And they respected my ideas when we were having discussions about her health, and they involved me. And I think that passport made a whole load of difference in involvement. They allowed me to go in, visit her at any time. I didn't have to wait for visiting times. They didn't ask me who I was visiting because they got to know me, out of hours. They allowed me to go in and make a bed for her and change her nightie and all those sort of things, which is what I would do at home. It made it a lot better for her. She felt it wasn't a stranger doing it all the time. It was me. That makes a lot of difference, especially for a female to a female as well.
That's fascinating. I didn't think of all of those different elements to it. I sort of assumed that it would allow you to sort of get into reception and they would know who you were and you could tell them what she would want, speak
Mm,
with her, for her, that kind of thing. But I had no idea it went as deep as that you could get
yes,
really involved in the care because, like you say, you would have been
yes,
doing that anyway.
yes. It did on this ward. That they were absolutely fantastic. I sat there helping her eat her dinner one day, and the charge nurse bought me a dinner. I said, "No, you don't need to give me dinner. He said, but you are helping us. So I think in a way, I was helping their staff. I was another member of staff, basically, because I was helping her, feeding, washing, dressing. Yes, they enabled me to do all that. And I was so pleased, and she was so pleased as well.
And that's the main thing, isn't it? That
Yeah,
she's comfortable in an unknown situation where you can feel very
yeah,
vulnerable, very
yeah,
exposed, to have
yes.
that comfort around you. And like you say,
Mm,
you were helping out. So if, say, the sandwich was put in front of her and she couldn't see to open it, she'd ring her call bell and
mm,
someone would have to come. Whereas actually, if you're there, you can do it
yes,
for her. You are
yes,
relieving the staff of those
yes,
duties. It's a
yes.
win-win.
Yes, yes. And a lot of carers do like to, they do like to go and help. They don't want to sit at home and keep ringing up and finding out how they are. And it was just amazing. It made such a difference to her as well. It's like a safety blanket for her, really. That's how I can explain it. It helped. And then I was allowed to go down to canteen and get food a bit more reduced, and the parking was a bit reduced as well. So yes, it just sort of it breaks down a barrier, I think. People will help you if it's like when you've got the Alzheimer's badge on. People identify that and they help you. If they can see carers identity passport on your badge, they come to help you and make things more accessible for you. They are more caring towards you as a carer and that person you're caring for.
It's so interesting you say that because I think uh, carers, by definition, are focused on giving that care to their loved one. You say you haven't got your lanyard on. It's such a rigmarole to sort of almost put your hand up and say, "Look, I
Mm,
need this," and you
mm.
almost don't want to ask because you think, "Oh, you're so exhausted,"
Yes,
and actually, you just want people to just do it, you know.
yes,
So if you're
so,
wearing the lanyard, it sort of stops you having to ask all the
yes,
time, which I think
yes.
takes a bit of pressure off, doesn't it?
Yes. Oh, I mean, when I see people wearing a lanyard, I automatically look down to see what it says.
It's that visibility, isn't it? And I
Yeah.
think as well, keeping the conversation going, keeping the discussions going about what caring responsibilities actually mean, what it means for the person who is a carer. Like we said earlier on, it's tiring, it's mentally and physically draining.
Yes.
But you also have that almost battle with yourself that you don't want to spend time away from her, but at the same time, you have to
Yes.
recharge and how important that
Yes.
is. And it's like you
Yes.
just want other people to recognize that.
Yes, exactly. Oh, you've taken the words out of my mouth.
It's
Yeah.
important to ask for help, and that help is out there. And the beauty of this
Yes.
passport is that actually you don't necessarily have to ask for everything now, you
No.
know?
My mum was a carer for my stepdad who had macular and Alzheimer's, and I could see her getting really, really ill. She was like on a roundabout that she couldn't get off. And I feel sometimes I'm on that, but I try and get off. Because she ended up in hospital quite ill from it, because she got exhausted. She actually went in and she was quite dehydrated because she'd just forgotten to drink, basically. She'd forgotten to, do anything like normal things, drink a cup of tea because she'd been so busy caring for him. So that's always in the back of my mind that, I'm not going to get like that. I don't want to get myself ill because I won't be able to care for her then, will I? But I must admit, I found Carers Matters really useful because they have opened up such hot doors for me. And one of those was the Carers Identity Passport. They sent me the link and then I applied for it and got it quite quickly. It's opened up so many doors for me and it's made life a lot easier for me and for my mum. It was just reassuring, especially this last time she was in hospital, and it was just lovely actually. It compared to her last time in hospital when I didn't have it, it was a godsend. I think the education on it is paramount really. There are leaflets and you see it advertised, but I think maybe more in-depth education on it would be quite good. I didn't really know what it was going to help me with until I started using it, to be quite honest. It's helped me no end.
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.